Hello, people. Welcome to yet another episode. In this episode, we want to talk about child abuse or childhood trauma and high blood pressure. In our last video, we spoke about the fact that high blood pressure has to do with the fact that the pressure or the force of blood pushing against the walls of your arteries are too high. So the question we ask in this video is this: that can the traumatic experiences that people go through during childhood or the childhood abuse that people go through, can that make them develop high blood pressure later in life, in late adulthood, in mid-adulthood, or even in adolescence? And the answer is yes. Studies have shown that people who were abused during their childhood, people who went through traumatic experiences during their childhood, have a higher likelihood of developing high blood pressure in late adulthood, in mid-adulthood, and also in adolescence. So this is true for people who have been abused verbally, insulted excessively, people who have been abused physically, beaten excessively, people who have been abused sexually, and any form of childhood abuse that you know of. So the question is, how is it possible that the childhood abuse or traumatic experience that people went through can make them later develop high blood pressure? This is because the side effect of childhood trauma or abuse never really stops unless it's dealt with. So because of this kind of abuse that people have gone through, their body stress response has been turned on and they develop something we call post-traumatic stress disorder, which means that the traumatic experience that they went through, they develop a kind of stress that is really disturbing their body. Yet they might say something like, okay, I'm fine, I'm good, I've been able to get over it. But no, it is unresolved and still somewhere in the brain and causing problems for the body. So what it then means is that this could explain why people are still struggling to control their blood pressure. So maybe the way to go will be to find a way, see a psychologist, see a therapist to help you deal with your childhood traumatic experience or child abuse that you've ever gone through, verbal abuse, physical abuse, sexual abuse. And if that could help you, then it means that you are now better going to be able to manage your high blood pressure. Some ways to deal with childhood abuse or traumatic experience that we went through. Cognitive behavioral therapy can help you deal with the negative thoughts that you've developed about them, the behaviors, the emotions. Do some relaxation exercises, do some meditations, so many ways, but it's best for you to see a therapist to work with you to help you overcome your childhood traumatic experiences or abuse, and then you will better be able to control your high blood pressure.